Hi guys, this video is all about embarrassed patient cases, how to make those cases a little bit simpler, because sometimes they can be a real challenge, not only in real life, but also in the CSA itself. And they're designed to be a little bit of a challenge. So we've come up with 4 key tips to allow you to make these cases a little bit more straightforward, to be a little bit less stressful, because time does tick away very quickly, as you know, when it comes to those 10 minutes. So let's get started. So the first thing to think about is focused silence. Things like listening actively. You've heard a lot about prolonged silence, golden silence, that sort of stuff. Never is it so important as in an embarrassed patient case. Often we get stressed about time and we start asking lots of questions, hoping that the embarrassment will settle down, and then they close up even further. Focused silence is so important. Show that you're really actively listening, you're in the zone, you're present, you're there for them, and you're willing to wait until they feel comfortable. A couple of nods, a couple of gets things going. Just let them be. Give them that time that they deserve. Don't stress about them taking too much time. If you give them the time initially, you'll find that time gets caught up very, very quickly later on. But if you try and push them and try and show your irritability and try and show them that you're running out of time, or you're stressed because they're being so quiet and so non-forthcoming, then you're going to make the situation worse. So focus silence, active listening, really show that you care and you're there and you're prepared to wait until they're ready to give you the stuff that they're going to give you. Secondly, what we often find when people do these types of cases, our courses, they use the confidentiality line way too quickly. A patient comes in, sits there, doesn't say too much, and bang, just so you know, everything that we do today, everything we talk about today is going to be confidential. Now, most people who are embarrassed are not worried about confidentiality. Confidentiality is important in certain cases, young people, certain topics. Fine, use it, save it for that type of thing. Don't just throw it in because someone's a little bit quiet. If someone's embarrassed, the confidential line is not going to get them to talk. What's going to get them to talk? A bit of talking, a bit of nodding, a bit of active silence like we talked about. Resist that confidentiality. Bring it in later if you really are struggling, you think you're clutching at straws for other reasons. But don't assume that they're quiet and embarrassed just because they're worried about confidentiality. And one of the other reasons for not mentioning confidentiality, what most people do is say, everything that we talk about today is going to be confidential. And then something comes out later on that actually, you can't keep that confidential. It's someone's at risk or something's happened that you just can't keep to yourself, and then you're in trouble. So if you're gonna use the confidentiality line, then make sure you give yourself a little window to walk out of. By far most things that you tell me today are going to be confidential. You've got that little escape pattern if something comes up that you really have to break it for. But the key thing is, if someone's a little bit quiet, a little bit embarrassed, don't jump to the confidentiality line literally within 20 seconds of seeing the patient. That's usually not the thing that's going to get you the information. Time, silence, active listening, these things are much better. Thirdly, you've got to acknowledge the emotion. There's no point someone appearing embarrassed and you don't allow them to understand that you've picked up that they're really embarrassed about this. Gosh, I can see you're really struggling with this. It's clearly a difficult topic for you to talk about. Just to let you know, we deal with these things all the time. I know it's really difficult for you, but just so you know, this is something that's actually really common and something that we can usually do quite a lot about. These types of things are so important. On one hand, you're picking up that this person is clearly embarrassed, but if you're not doing something about it, then you might as well have not picked that up in the first place. So it's all about acknowledging the embarrassment, again, making the environment comfortable for them, and you'll soon find they start to elaborate and tell you things that you were trying really hard to ask about before you acknowledged it. And finally, offer them some alternatives. If you really find that they're embarrassed or they're really struggling to open up to you, come up with a few alternatives. Would you like to come back and perhaps see me in a couple of days' time? Or would you perhaps prefer to see another GP about this? Offer these things. Now, they're not going to probably say yes in the CSA because you're still going to have to deal with this situation. But it just shows that not only have you picked up on that uncomfortableness, you've put something in place to try and ease that discomfort level, even if you know they're probably not going to take it up in this particular situation. But certainly think outside the box, think about offering alternatives. Sometimes that might be the trigger for them to get talking. So as you can see, embarrassed patient cases can be a little bit of a challenge. They're designed to challenge you a little bit. We focus a lot on embarrassed patient cases in our courses and at our marks. But keep those 4 things in mind. They should help. Focus silence, really important. Really show that active listening. Make sure you're showing that you care and you're giving them time. Confidentiality line. Don't throw it in straight away. Don't think that's the thing that's going to suddenly open them all up. It's usually the thing that's going to make them more worried, to be honest. Why are you worried about confidentiality? Thirdly, think about acknowledging things regularly. Really show that you understand that they're embarrassed and just reassure them it's really common to feel like this. And finally, think about alternatives. If you're really stuck, do they want to come back another time? Do they want to speak to someone else? So think about those 4 things when you do your next embarrassed patient case, whether at work or whether practicing your study groups. If you are taking the exam in the next couple of months, good luck. If I do get to meet you in the next few months, that's great. Check out some of the other videos. If you have any other videos you want me to produce for the CSA or GP training in general, just give me a shout. My details are down below. Tweet me, email me, whichever is easiest. If you did find it useful, subscribe to our channel. We do try and do 1 or 2 videos every month, and hopefully they have some benefit.